Good morning, everyone. Thank you for joining us. We're here today to talk about another aspect of COVID-19, its effect on children and caregiver loss. I recognize that we're starting this conversation at a time when we're all a bit, again, in a place of uncertainty with the onset of a new variant. Just as some of us thought we were turning the tide, we're back again in an unsettling place. And even though the news focuses primarily on our efforts to prevent and detect and respond, we're also aware that this crisis has other impacts, secondary impacts, including the effect on children. And although children are not dying at the rate of older people, they are of course profoundly affected when their caregivers die. And we have new and emerging evidence that this has affected about 5 million children. 5 million children who don't anymore have their primary caregiver to help them navigate the uncertainty that we're all facing. And although the news is dark, I'm reminded of Mr. Rogers, who says, look for the helpers. You'll always find people who are helping. And today I am heartened that we have helpers by our side in this conversation. These are people who fully have wrapped their heads around the data, are helping us understand the impacts, and also have a good grasp of best practices and solutions that can lead us productively into these uncertain times. So thank you for joining us, Philip Goldman, Aniruddha Kulkarni, Gretchen Bachman, and Catherine Marshall. You are all lampposts to help us through these uncertain times. Thanks also to Ruth Gopin, Amy Vandervliet, and Yenny Yang for helping us to coordinate this event. I'm Gillian Hubner. I'm the director of Georgetown University's newly launched Collaborative on Global Children's Issues. And we are a university-wide initiative that seeks to foster cross-disciplinary research and dialogue on critical and emerging issues affecting children worldwide. We're primarily focused on children in adversity, but equally focused on pathways to resilience. And we are a collaborative because we understand that we can't do this work alone. So in that vein, we're working today together very closely with the Berkeley Center on Religion, Peace, and World Affairs, and also Georgetown's Global Health Initiative. All of our efforts fit within Global Georgetown. Our panel today is going to focus on coronavirus-associated caregiver loss and the work being done by the international community, the US government, and faith-based actors to support vulnerable children and turn the tide towards better care. This webinar is being recorded, and a captioned video will be shared to all who have registered and will be posted as well on our websites. So if you registered for today's event, you will receive an email with the follow-up information. We're going to have a conversation between our lampposts, but we also invite you to participate in the conversation. You can enter chats or questions along the way in the Q&A box, and we'll leave the last 15 to 20 minutes open for dialogue between our panelists and also the community. So thank you for joining us. We're going to start with Philip Goldman, who is the co-founder and president of Maestral International. He's also a member of the Lancet Commission on the Institutionalization and Deinstitutionalization of Children, and a co-author of a research article that the commission produced for the Lancet. He's also a member of the Global Reference Group of Children Affected by COVID-19 and a co-author of a paper on parental and caregiver loss estimates. Philip is also a leading figure in our field of protection for children outside of family care. And we're so glad to have you with us today. Philip, if you would, can you share with us about the recent articles published in the Lancet, Global Minimum Estimates for COVID-19 Associated Orphanhood and Death Among Caregivers, and help us understand the story that the data is telling us.
Thank you, Gillian, and thank you all for attending. The story is pretty grim, and you're right, this is a very unsettling time with the new variant that is coming out. It's reminding us all that the data that I'm about to present are really just the beginning of an unfolding saga of how children are being impacted by this terrible pandemic. We were concerned enough as we started digging into the data quite some time ago about what we were seeing in the very early days of COVID-19. I do want us all to keep in mind that there is what we know now, but what we expect may be happening in the months and perhaps years ahead, particularly noting that the current vaccine rates in many lower income parts of the world are hovering around 5–6%. So let's go ahead and take a look at the data. The reports, our work was published in the Lancet in June. There's a citation on the lower left of the slide. You can pull your cell phone out if you're interested in that. It came out with a companion volume that you can see on the right, also available online, that goes into a little bit more detail than a research article can on what we were learning. The research included a pretty robust analysis of the data on the impacts on children, but we also wanted to make sure that there were some fairly clear policy recommendations on what might be done to address the issues of caregiver loss. You'll be hearing about those recommendations a little bit later in this meeting. And we did receive some fairly widespread media coverage. There was a follow-up report on the mortality in the US and the impact on children. That was covered on PBS just last night, actually. There was a segment on that. We're looking at about 140,000 children who've lost a parent or caregiver in the United States alone. But I think there are thousands of media outlets that did run with the research, and we're trying to continue to maintain that exposure as the pandemic progresses. So our aim was to provide a minimum estimate of COVID-19 associated parent and caregiver loss. We used data from 21 countries in the most COVID affected areas of the world. And we used the average number of children per family and the COVID-19 associated death rates using both official data and excess deaths to estimate the average number of children who are losing a parent or caregiver in each country by sex and age group. And we had a really, I think, good representation of different organizations across the author group. A colleague from the CDC was the lead author who assembled us, but we had USAID, World Health, World Bank, and a range of universities and other organizations that participated in the research. And when we published in June, we found that about 1.5 million children had lost either one or both parents, usually just one parent, or one or both custodial grandparents, meaning a grandparent living in the home, or a co-residing grandparent who was not necessarily the primary caregiver, but was living in the home and likely providing some level of care. Since that time, that number seemed big enough to us then because that was fairly early in the pandemic. We have revised our estimates upwards because we have better data at hand. We've been tracking the data on a weekly basis. The total number of children who've experienced the loss of care is 2.7 million as of the 30th of April, 2021. Of those, 1.8 million have lost a parent to the disease globally. Keep in mind, this is a minimum estimate based on a very, very strict methodology. It is quite likely, we believe, that the numbers are substantially higher than the ones that we're presenting to you today. But in order to get this published in the Lancet, we did have to be fairly strict on how we approach the data. As of today, or just a few days ago, the numbers have increased, as you can see, fairly substantially to a total of 5.2 million children who have lost some form of parental or grandparental care in the home, and of those 3.3 million have lost a parent. And what you're going to see here is, in some respects, my most worrying slide, because through the end of 2020, there were 1.8 million COVID-19 deaths in our data set, with about 900,000 children who were affected by caregiver loss. The rate of loss has doubled between the end of 2020 and, in this case, June of 2021. So when we first started doing our research, we were saying that a child is losing a parent or caregiver every 12 seconds. Now it's every 6 seconds. And we don't know where this pandemic is going, but we do seem to be seeing the beginnings of another surge after a flattening out. And the projections of mortality from COVID-19 are really pretty grim through March, April of next year. And at this pace, we're roughly looking at every loss of an adult is accompanied by a child losing a caregiver. That is, let me put it a little differently. There's a 1-to-1 ratio roughly now between the mortality rate and the number of children who are losing parental or grandparental care. And this is just an example of one country. We did set up an online widget, which you can access at the address below, or Google Imperial College Orphanhood, and it will pop up. You can obtain the rates globally or by country. This is India, where we're seeing in our, again, minimum estimates, 2 million children who've been affected. And look at that sharp curve, especially since the summer of that loss. But again, with the minimum estimates, this could be actually underrepresented by some multiple of children who've experienced loss. And with our widget, you can see it's not just India. In many countries around the world, we're seeing these sharp curves since the summer, a little bit of a flattening out in the fall, and now we're starting to see that, that surge again, just starting to pop up. Not surprisingly, in countries with high fertility rates, in countries where there are more children per family, we're seeing higher levels of children who are losing parental or grandparental care. So this just shows you the curve between the total fertility rate, the number of children born into the household, and the ratio of children orphaned due to COVID-19 associated deaths. So what do these numbers mean? And we looked at the beginning stages of HIV, which we often hear the term orphan crisis, orphan and vulnerable children, related to the effects of HIV. Well, in 1990, we were looking at about 903,000 children who lost a parent to HIV/AIDS. In 2020, we're looking at 1.1 or more million children who've lost a parent to COVID-19. So this is very, very worrisome, especially looking at the trends. It took the world about 5 years to reach an orphanhood level of about 5 million children due to HIV. We're already looking at those earlier numbers, maybe 3.3 million as a minimum estimate into the second year of COVID-19 of children who've lost parental care, and that 5.2 of the children who've lost also other caregiving in the household. So these numbers are really worrying. And if you couple that with that steep curve and that increased rate, and the fact that we're looking at a pandemic that is global in scope and affecting all countries regardless of income, in many cases, some of the worst rates are in the higher income countries, we do have a lot to worry about here. I also like to note that we still have a number of really, really big issues impacting children's lives beyond COVID-19 that were in place and that we were trying to address prior to the appearance of this pandemic. They include, of course, HIV/AIDS and other diseases, but climate and conflict and migration issues roughly 1 billion children worldwide being subjected to some sort of violence or abuse every year. And then with COVID-19, beyond the issue of mortality of parents and caregivers, we have estimates from UNICEF of 150 million new poor children who are newly poor as a result of the disease. That's a 15% increase in 1 year. Increased reports, I mean, just everywhere we look, of violence against children, domestic violence. We have children in lockdown with lack of access to education and health services. Again, terrible reports of just a huge uptick in child marriage and teen pregnancy and the like. So overall, the ability of communities to be resilient to the impacts of this disease, to respond to the terrible increases in poverty and the mortality and nutrition effects, and we can go on, has really been compromised by COVID-19. So a child losing a parent or caregiver is likely living in a community that is less able or prepared to be able to respond to that loss. I was a member of another Lancet commission that focused specifically on what happens when children are outside of family care and placed in residential institutions like orphanages or children's homes. We looked at over 300 studies of children in those settings and found, I think, a core message here that just how important family care is for children. And when children lose care, they have poor physical, cognitive, emotional, and social development outcomes, and are also at much greater risk of other adversities such as violence or abandonment, ending up associated with the street. I encourage you to look at this research if you're interested at basically understanding when you take children out of that family environment, because they're really wired to be in a family and ideally in a safe and nurturing family, just how profound the impacts are with that family loss. And so I bring this up because with so many millions of children now facing parental and caregiver loss, there are some real concerns about what's going to happen with them. This is just to show when children have been placed in residential care, there can be some pretty serious impacts on their growth, head circumference, cognition, attention, socio-emotional attachment, and overall health. And getting them out of those settings and into a family setting is really a great way of reversing this. We actually see a lot of resilience in children who are placed in family settings. One of our recommendations, and you'll hear more, is to avoid institutionalization of children who are being affected by COVID-19 caregiver loss. And at all costs, we need to try to keep them in that family environment. So what are the risks when children lose parents? And I'll be closing shortly. Family separation and placement in residential care is what we don't want, but that is a risk. Placement in alternative care by kin, if there are no parents or if parents are unable to, or a surviving parent is unable to care for them, they may be placed with other kin, foster care, the Islamic practice of kafala, or adoption. They can also end up on the street. Bereavement is a big issue. There are lots of studies about the psychosocial impacts of loss of parents or care on children, which can be lifelong. There are definitely a lot of studies showing increased risks of lost household income and higher poverty, and of course, poor nutritional status associated with that, and increased risk of abuse and neglect. Well, why did we include grandparents? Grandparents play a very important role in care around the world, including here in the USA. In Brazil, 70% of children receive care from grandparents, and in the USA, 40% of grandparents who are living with children are primary caregivers. So that's not at the margins. They could be quite important. And some of the impacts of the loss of a grandparent are similar to the ones that come with loss of parent. And that's loss of household income and the reduced ability of other adults to participate in the labor force because of the care that grandparents are providing. There's some evidence on the ability of children to attend school being more compromised by the loss of the grandparent, and loss of guardianship or other forms of care of children in those households. So we really did want to capture that, that dimension of grandparental loss. And finally, our other concerns on these losses are, again, based on historical evidence from other epidemics or emergencies. We tend to see an uptick when there's loss and care in domestic violence within the household. We see a downturn in the nutritional status of children in households, including micronutrient status, access to preschool and early childhood development, which is such a focus of many organizations working globally, can be compromised. And of course, when you lose care in the household, you lose all that stimulation that that caregiver was providing, which is particularly important in the first 5 or 6 years when children are developing so quickly. So Gillian, with that, I'll hand it back over to you and for others to talk a little bit more about what we need to do about this.
Thank you so much, Philip. That's stunning, sobering data. And it's actually just so heartening as well, though, to see how the authors came together. And I know you all have been working together over many years in response to the HIV/AIDS crisis and other impacts during Ebola and whatnot. So thank you for making the data readily available for us so quickly. I know it felt like a long time to get it through the publication process, but I think actually that was pretty record timing for that kind of comprehensive data set to work with and really ground us in our response. So I'm going to turn to Aniruddha Kulkarni, who is a child protection specialist and UNICEF's global lead on child protection systems. He's been with UNICEF for 15 years. And prior to that served as a senior research coordinator at the College of Social Work in Mumbai, India. So Ani, we've laid some groundwork over recent years and you've been at the forefront of those efforts. In 2009, the UN General Assembly unanimously passed the guidelines on the alternative care of children, giving some guidance to how the international community should think about children outside of family care. Some of that guidance was a little bit vague, and there's been a strong global movement to sort of, improve the guidance and ground it in best practices. And we saw a huge step forward just before COVID-19 hit us. In December 2019, the UN General Assembly unanimously adopted a resolution on the rights of the child for the first time, focusing on children outside of family care. And that resolution was largely informed by a massive group in our sector. It's, I think, quite massive, 250 plus global organizations who are working on behalf of children outside of family care. They put forward recommendations and the UN responded by adopting them into the Rights of the Child resolution. So that gave us a good roadmap, right? Something to work on. And I'm curious, from your perspective, sort of overseeing this global work on child protection systems worldwide, what are some aspects of the resolution that have impacted the global response to the COVID pandemic? And to what extent has this global care reform movement influenced the response? So over to you.
Thank you so much, Gillian, and thank you for inviting me today. It's really a pleasure to be amongst all of you and speak about this important issue. And you're right when you said that, 2019 UNGA resolution was a fantastic opportunity, but I wanted to take a step back to see where care reform as a whole really stands within the larger development agenda, so to speak, or the global development priorities. And unfortunately, and although in 2009 we did have the guidelines, we saw that the Millennium Development Goals missed alternative care, and so did the Sustainable Development Goals. And why it is important to recognize that care reform was not included in the SDGs is because that has directly impacted the investments in the care reform sector as a whole. So it's important to know that a lot of positive developments have taken place, but there is still challenges that continue to remain on the global level to really influence and push forward the reform agenda. And of course, 2019 was a fantastic opportunity. I think the global community really seized it. And in particular, actually, the civil society did a phenomenal work of coming together to really advocate for some of the key priorities. And I wanted to take another step back to actually link it to what Philip was talking about in terms of the resiliency factors, or actually the lack thereof of resiliency factors. And, we know that some fantastic work has happened in terms of prevention of separation, promotion of family-based care. But as Philip mentioned, and we have seen repeatedly from the HIV pandemic through COVID-19 pandemic now, that the pandemic has really had an impact on the situation, but it's vital that we recognize that the causes that trigger family separation are often very systemic. And I think why I'm talking about it is because the global community, when it came together to talk about how a resolution should look like, was really focusing on those systemic issues. And poverty and lack of basic services such as quality and inclusive health and education continues to remain a big challenge for us. And that is one of the reasons that is driving children outside of parental care. We also know that in many cases, decisions continue to be made without the application of due process. And that actually challenges the very premise of necessity and appropriateness of alternative care, which was laid out in the 2009 guidelines. We also continue to struggle to really examine, promote, and upscale local solutions that are founded in local and indigenous knowledge and traditional practices, especially those solutions that are focused on preventing family separation and promoting family-based alternative care. I think one important group of children that we must recognize is more affected, at least in some regions, is the children with disabilities. And that is also a systemic challenge that we are facing, because the stigma, the discrimination, and the lack of access to inclusive services is really disproportionately affecting children with disabilities. And another issue that is increasingly affecting children is migration, because we are seeing millions of children moving with families, without families, and the risk of family separation is increasing. But at the same time, we are not doing as much as we need to do to prevent detention of children and placement of children in alternative care when it is needed. So all these challenges are really contributing to what we are seeing as how the pandemic is affecting children and family separation issues, and they all come together to affect children and families. But coming back to the UNGA resolution, and as I said, the civil society really seized the opportunity because they were able to analyze these issues in far more details. And I think you're right when you said that the guidelines on alternative care had some some openings, but we still needed some more specific, guidance on what needs to be done. And that's exactly what happened with the UNGA resolution, especially the advocacy around the UNGA resolution, where, as you said, more than 250 organizations came together to put together a comprehensive set of recommendations. We were very happy and fortunate as UNICEF to be part of that process. But, we really put together a solid set of recommendations that talked about recognizing and prioritizing the role of families. I think that's something that needs to be really pushed for. And what is it that we need to do to support families, to prevent family separation? And how do you recognize the importance of caregiving roles and responsibilities, and what additional families support families and parents require to fulfill those responsibilities? So the recommendations were able to focus on that. And of course, we spoke extensively about high quality, appropriate alternative care. We also had very, very strong emphasis on recognizing the harm of institutional care and the need for strengthening welfare systems and child protection systems as a whole. An area that has often not got enough attention is financial resources and human resources for the sector. And what happened was that this momentum that was gathered before the UNGA resolution and throughout the UNGA resolution and the key recommendations helped all of us to speak in the same voice. We had a collective voice which was very strong, which was well informed based on our knowledge, well informed based on our knowledge of what we still don't know about and what we need to understand better. But we were able to speak in one voice, and that actually reflected to a great extent in the resolution itself. The resolution did recognize the harm institutions can cause for children and called for a progressive elimination of institutionalization. And there is also a lot of emphasis on prevention of family separation and the need to keep families together and investing in families, for example. The resolution also spoke about disability inclusion and the need to address the specific needs of children with disabilities. And for the first time, I think this was also due to the great advocacy by civil society organization, the resolution actually recognized the role of volunteering in orphanages, for example, and how it can be harmful for children in terms of both prevention of separation as well as trafficking and exploitation of children. So a lot of this momentum that gathered around the resolution actually helped us come together more effectively to also respond to the COVID-19 pandemic. In March sometime, March 2020, soon after WHO announced the pandemic, the civil society formed a task force, an interagency task force. And that task force very quickly, within a very short turnaround of 4 weeks or so, came up with an immediate response measure guidance. And that guidance was also to a great extent informed by the process of the recommendations, the UNGA resolution, and the knowledge that we have at hand. And that was followed by a more detailed guidance in September last year, where we really addressed the medium and long-term issues and the measures that need to be taken in terms of care reform. The guidance was also able to address some really critical and challenging aspect of care reform. And I'll just give one example and stop. I wanted to talk about the residential care aspect. The guidance was right from the beginning very clear that we should put a moratorium on setting up new residential facilities, because we have seen from the past experience how harmful it can be as a reaction to a pandemic to set up new residential facilities. But at the same time, the guidance also addressed concerns related to the rapid return of children from residential care facilities, because we saw in so many countries, children were moved out of residential places and being sent back into families and communities. So the guidance really provided advice on how to safely plan and safeguard reintegration and so on and so forth. So I would say that really the global momentum, right from the UNGA resolution and before that to where we are now, has really helped us all come together and work together in tandem. And we've seen that as recently as with the Day of General Discussion that happened in September 2021, which the CRC committee had organized. We are able to build a lot of consensus around several key issues around what must be done in terms of care reform. So I would stop there and look forward to our conversation. Thank you.
Thank you so much, Ani. That was really helpful to get the summary, and we'll share some of these documents in our follow-up email because it is a lot to unpack, and the guidance and the key recommendations are available. We'll make sure to share those. I think one of the things that has been so heartening too is to see the language and the guidance really changing and focusing more and more on prevention and what can be done at the community level, really focusing on local responses, community-based responses to prevent the family-child separation even before it occurs, and really invest in the family as the primary source of strength and resilience for individual children, but also for the community. And so much of that learning has actually come from the global response to the HIV/AIDS pandemic. And Gretchen Bachman is with us today to talk a bit about that. She is the Senior Advisor on Orphans and Vulnerable Children within the Office of the Global AIDS Coordinator and Health Diplomacy at the U.S. Department of State. And she's also a leadership committee member of Together for Girls, which focuses on preventing violence against children, and a founding member of the Better Care Network, which is a global network of organizations working to inform better care alternatives for children at risk of losing parental care. So Gretchen, this year, 2021, marks 2 decades of progressive reductions in HIV/AIDS prevalence. Yet as a lasting legacy, there remain more than 15 million children who've lost one or both parents to AIDS. So how can lessons learned from the HIV/AIDS response be adapted to this current crisis and its impact on children who are losing caregivers due to COVID-19? And how are these lessons reflected in the US government's global response to the pandemic?
Thanks, Gillian, and thanks for having me here. You know, I think there's some very practical ways that, and that we already are bringing in lessons from what we learned, are learning with HIV and AIDS. Philip and I have both been part of the global reference group on responding to COVID. And I think that is how you kind of learn from each other and moving forward. And I have to say, we in the HIV and AIDS world owe a big debt to those who worked with child soldiers and children in other emergencies when we started responding initially to HIV and AIDS. So, I mean, gosh, I could talk about this for a long time. So do stop me if I go on too long. But, you know, I think a lot of the themes you've already heard in what Philip and others have already talked about in terms of what's important. But I guess if I were to really boil down what I would say to somebody who said, what do we need to do now? I would say that maybe we didn't do right, or we at least initially didn't do right around the pandemic for AIDS, is one, to always remember that while we want to save the children and focus on children, that our message should always be save the families, save the families, save the families. And when I say that, it's because even with AIDS, the vast majority of children have lost one, not both caregivers, right? They have a single surviving adult. And if they don't have a single surviving parent, they have an aunt, they have an uncle, they have a grandparent, they have an older sibling, and or they have a foster parent willing to take them in, or an adoptive parent. So those families need to stay together for the health and well-being of that child, right? And so our question should be, how do we save the families? And to do that, I think the most compelling evidence, quite honestly, is on economic response, I think. And to keep in mind that, well, I would say for one, I just want to back up a second. I think one of the mistakes, maybe if you could call it that, that we made during the 90s and the late 80s in terms of responding internationally is people were very concerned about children being orphaned, but there was really not treatment widely available to save the parents, right? And there's no intervention you can do for a child that is going to be more helpful for their long-term well-being than keeping their parent alive and well, right? I mean, we just can't make up for that once that parent is gone. So I think that, and in our report, we talk about, hey, the first thing is you need to get those vaccines out and you need to save people, right? That is huge. We can't underestimate how important that is. It's important both to prevent children from becoming orphans, but also to save the adults that are there to take care of the children who are already orphaned. We saw before treatment, we saw children who were orphaned multiple times. They would start, they would lose their own parent, they would move to an aunt, they would lose that aunt or uncle, they would move to a grandparent, it was just a domino effect that was awful to watch. So I just can't, emphasize how important that is. But in terms of the economic support, a couple of things, in the reports that Philip has talked about, and in the Pediatrics Journal article on US effects, in US effects, but also in an upcoming but not yet published piece that the same group has been working on. We've lost more men than women. And because of the inequities in terms of earning capacity, that has meant that families are taking a harder hit economically with losing their primary, in many cases, wage earner. And so, for that reason, for the extended families who take in children, that economic support is really critical. There was a story I remember in the news that came out this summer from India about a grandmother saying, I want to take in my grandchildren because both the husband and wife had died. People keep telling me they're going to help me and take that child to an orphanage. And I keep saying to them, I will raise my grandchildren, but you need to help me do that, right? The income earners are gone. I'm elderly. I can do it, but I need help. And so that economic assistance is critical. There are different kinds of economic assistance, but in the short-term emergency phase, cash transfers are hugely critical. And I know, Gillian, you know that from all your work in emergency response, that it's not goods that people need. It's not materials. I mean, they may need some of those things, but those surviving adult family members, they know they know, and they will act in the children's best, interest, whether that's healthcare, school fees, housing. And you can't decide that from a program level without a lot of funding just to do the assessment and design of programs. The most efficient, effective way is cash transfers. And so that has to be a very big part of the response. Both for surviving parents, but also for extended family members, foster families, adoptive families taking in children. There's a lot of research on that, not just in the HIV world, but in, I'm happy to share some articles. If you look up Lucy Kluver, Cluver, you'll find lots of articles by Lucy and others on what she calls cash plus care. The care part really talks about parenting support and skill building, which is that is important for any parent, in crisis or not in crisis. A basic understanding of child development and positive discipline is good for all parents. It's also very important to mix with the cash in terms of supporting families in crisis. So I would say that is very important. And I'll stop in just a second, but I would just say the last thing that I just want to talk about, because Gillian, you mentioned this as well, is build local capacity, right? Let the local people do it. They will do it. They will step in. You have lots of, you talked about helpers, right? Neighborhood helpers. Annie E. Casey Foundation came out with a number of years ago, a whole series on neighborhood helpers, because the fact is, it's your neighbor who's going to come in and check if you're okay. It's your extended family member who's going to provide childcare if you need to go back to work. So, but it's also one step beyond that. It's the churches and mosques and temples who are going to do the initial and the continuing outreach to families in crisis. And it's the government folks in child protection who are going to be making decisions about placement of children who may not have a readily available kinship care. So all that we have invested in PEPFAR, the President's Emergency Plan for AIDS Relief, in terms of building both community level and government, local and national level, to build stronger child protection systems, to do strong gatekeeping so that instead of putting children in orphanages, good decisions are made about children's placement. I mean, all of those things are providing the infrastructure now, I think, in countries where that are being hit hard by COVID. I think just as we are in a better position to respond to COVID because of the money we've put into getting out HIV/AIDS treatment, we're in a better place to respond to children affected by COVID who have lost their caregivers because of all the work that's been done around the social service workforce and child protection system. So could talk for this about all day, talk about this all day, but I'll stop there because I know you have lots of other good questions.
Thank you so much, Gretchen. And you've been at this for such a long time. I mean, you're really shepherding this field. And I think one of the things that we forget sometimes is that so much of this learning has come out of your programs. And, you know, kudos to the US government for being innovative and actually setting aside 10% of the funding for the President's Emergency Plan for AIDS Relief for a response specifically for the children. And that, you know, that's a model we'd love to see in all of our responses, right? I mean, let's really set aside funding and expertise to respond appropriately with these best practices. So thank you for your leadership in that. And I think you made a perfect segue to Catherine Marshall. So Catherine is a senior fellow at the Berkeley Center for Religion, Peace, and World Affairs. And she leads the center's work on religion and global development. She's a professor of the practice of development, conflict, and religion at the Walsh School of the Foreign Service. And she helped to create, and she now serves as the executive director of the World Faiths Development Dialogue. She's also the vice president of the G20 Interfaith Association, and she worked at the World Bank from 1971 to 2006, also somebody who's been at it for a really long time. So, Catherine, the Lancet article and the CDC report both underscore the need for a coalition of care, what Gretchen mentioned, a priority that's well aligned with a religiously linked commitment to the common good. And we know, as Gretchen mentioned, that faith-based communities are often on the front line of the response. And yet there's a sticky spot there, right? We know that faith communities have had a tendency to perpetuate a reliance on residential care, institutionalization of children, and orphanages. There was a recent report, the Barna report, that indicated that Christians in the United States give approximately $3.3 billion annually to support orphanages. That's actually higher than the US government's foreign assistance funding for children. So what is the role of faith-based communities to turn the tide towards better care for children who've lost caregivers, especially important at a time like this?
Well, thank you, Gillian, and thank you, colleagues. Those are excellent questions. I wanted to focus on three dimensions of what is this huge crisis. The first one is really turning on the question of the hidden crisis and the understandings of what the crisis is and how we move from sympathy to action. The second is the problem of silos, which is one that I'm deeply aware of. And then the third is this frustrating, and you described it, sticky, stubborn debate about institutionalization. So first, I think that this event, but the Lancet article, the broadcast last night, is a vital part of the rather overwhelming COVID crisis and conversation. But in this, the fate of children generally has not had the focus that it has in other crises, because for so long it seemed that children were relatively protected. And what focus there has been has rightly gone to the massive crisis of schooling. and the problem with what 1.6 billion is the number that we're using of children who've been out of school, sometimes for very long periods, and with that, the loss of so many other features, but also the questions of abuse, the refugee children, the children on the southern border of the United States, so many different dimensions have children deeply embedded, and that is something that religious communities instinctively gravitate towards. It's part of the tradition, and yet I think to date they found it hard to know what to focus on and how to translate basically the ideals and the traditions and the compassion, the stories into something that is effective. So I think that the question of awareness, bringing these stories, bringing the statistics into something that people can really visualize and understand is absolutely critical. And it is something that this vast world of religious institutions really will gravitate towards instinctively. The second issue is that in our policy discussions, and I've been sort of trying to build bridges now for some 20 odd years of trying to raise the awareness that the religious world, it's by some measures, 84% of the world's population has a religious affiliation, but it's just this extraordinary mosaic of institutions and leaders and funding sources and traditions, practices. There has been a tendency for it to be excluded from many of the central policy circles. And if there's one thing that we cannot escape in the COVID crisis, it is the interconnections, that each sector is connected to the others, different regions, different traditions. The orphan crisis is clearly connected to the school crisis, to the abuse crisis, to the refugee issues, to conflict, you name it. And right now with the vaccination issues and the vaccine inequities, has been extraordinarily difficult in a strategic and systematic way to bring the potential good, but also the potential harm that is linked to these religious perspectives into this central policymaking. And I think that applies also with the crisis we're talking about today, which is the loss of caregivers, that so much of the response, you cited the number, the extraordinary amount of funding that is going, as well as what is available. And one has to ask how far that's really part of who's sitting at the right tables where the decisions are being made. The third dimension, which has also been alluded to, is that there is a very frustrating set of debates about what is best for children who've lost caregivers. And some of this is deeply embedded in stories, in traditions, religious traditions about what is right to do with a child. Is it, and for many, the instinctive answer, they've read about it in stories, et cetera, from the time they've been young, is orphanages. And an orphanage is visible. You have, unfortunately, orphan tourism, but you also have extraordinary stories of care and compassion in the Northern Triangle countries, in Cambodia, in Southern Africa. And people's minds are built on that. So the fact that the evidence shows so clearly that orphanages are not the best way to care for children will evoke quite often a response of yes, but. And I think part of my concern is that we need to advance a dialogue that addresses the yes buts. That it may, for example, include the fact that orphanages are seen as a better outlet opportunity for education in situations where the quality of schooling is appallingly bad, or where there's violence, or where children who go into extended families, in fact, are mistreated. I think the basic issue, which have been referred to by each of the previous speakers, is that in fact, the kind of support that the local communities, whether it is a nuclear family or an extended family or the broader community, is actually receiving is a very small fraction. The number of people who actually are getting help is still very small. But I think we also need to expand the programs that work, find ways to bridge the kind of broad statistics we're looking at with the realities of each diverse, complicated family and community without romanticizing the family, and find ways to engage in the kind of discussion that will change hearts and minds, and that will take us towards the kind of systems and programs that do exist, that we know they exist, but that will help us to overcome the yes buts, that the family is abusive, the child is neglected, and that the institution is the only way to achieve that. I do want to emphasize, we've been looking at this in a number of parts of the world, and it is a debate more than a dialogue that really needs some thoughtful, creative attention to finding better ways, which of course is the core theme here, to deal with what we know is an enormous, painful, and complicated problem that is one of the many dimensions that's associated with this COVID crisis. So Gillian, I'll hand back to you.
Thank you, Catherine. Yeah, it's so important to raise the nuances, right? And the debates are there. We have good evidence, and yet changing the way we do things is a gradual process. And I think you actually set up a question for Philip there, because Philip is very closely involved with the Changing the Way We Care initiative, which is actually, hook, line, and sinker with the Catholic Relief Services, working quite closely with faith-based communities around the world to change the way we are responding to children outside of family care. So Philip, I know that's just one example, changing the way we care, but it's a really important one, and it's gaining a lot of traction, and also sharing methodologies and bringing people to the table and into the policy debate. So can you tell us a little bit about how that came to be, where it's going, how the faith community is responding?
It is really exciting. Changing the Way We Care is a USAID Global Development Alliance. As Gillian mentioned, it's a partnership of Catholic Relief Services and our organization, Maestral International, with additional funding from the MacArthur Foundation and the GHR Foundation. We are really looking at how we can promote safe and nurturing family-based care for children around the world as a better alternative to the range of issues that Catherine just mentioned that children face in their communities. A lot of times people are surprised to find out that anywhere from 80 to 90% of children who are in residential care settings like orphanages have a living parent, let alone, as Gretchen mentioned, other potential care from other family members or care within their communities. So the word orphanage, we almost have to drop because they don't house orphans. But when you look at best practices and, well, how do you address poverty then? Well, the children are poor, abject. No organizations out there that really work on the poverty agenda, look at the World Bank, UN organizations, UNDP, UNICEF, and the rest, ever promote orphanages as the solution to poverty. We can serve 8 to 10 children in their communities with anti-poverty programs for the cost of one child in an institutional setting like an orphanage. Disability. Well, a lot of children with disability end up in these settings, but no disability organizations working on global strategies promote residential care. Instead, they're promoting inclusive care for children to remain in the communities and to stay supported. And we can say the same for violence, which is quite endemic around the world, and other types of issues that children might face. So changing the way we care is trying to get that evidence out. We have 3 demonstration countries right now, Kenya, Guatemala, and Moldova, working really quite intentionally with government and faith-based actors and community-based organizations to transition even the thinking away from residential care maybe being the first best option to that community-based care. Family strengthening programs are being supported, psychosocial support, parenting programs, and most importantly, and something we could speak more to, is the social work profession. It's training people in these communities to have a social work orientation that's been so lacking. PEPFAR has actually set a good groundwork for that with the HIV, many years of working with HIV and AIDS and trying to build up that social work capacity to deal with the multidimensional needs that children and families face. I think what Changing the Way We Care has been trying to do is to build on that to improve how communities can respond to the potential loss of care, especially parental care by children. Under COVID-19, just quickly to wind up on Changing the Way We Care, a lot of countries were deinstitutionalizing children as a response. They thought that the institutional settings were risky. So countries like Kenya or India, we saw quite a large number of children who were summarily just placed back into their households without any real thinking about the kind of supports that they needed. We're trying to actually seize that as an opportunity of changing the way we care to keep those children at home rather than re-traumatizing them by separating them yet again from their families and placing them back in a residential care setting. We do a lot of global advocacy. We do a lot of work with, we've been talking a lot with the Vatican in particular recently, but with other faith traditions about how they can work on this issue. And the last thing, and maybe a question for my other panelists, if I may, Gillian, is COVID-19 kills quickly, right? You have days or weeks, unlike HIV, which takes quite a long time, and families are a little bit better positioned to prepare for the loss of an adult in the household. I'm wondering, Gretchen and Catherine in particular, you know, this is a bit more like Ebola in the rapidity of the progression of the disease, but it's at a much more global level. How can we think systemically about rapid response mechanisms that children may need, whether delivered by government supported programs or by faith-based actors? I wonder if you put any thought into that.
Well, I don't see Gretchen's mouth moving, so I'll start. I mean, a broad answer to that is that the infrastructure of world religious communities is the most present and has in so many ways the capacity to know what's happening to families within communities. Of course, the COVID pandemic has cut off a lot of normal communication as temples and churches and mosques were closed. Interestingly, by the way, in some places, it seems that the madrasa systems, the Islamic schools, are staying open, for example, in Bangladesh, when the rest of the school system is closed. So you may have specific examples. And the difficulty is, of course, that we all advocate for the local. Everything is local. The solutions have to be local, but that means that they're very, very decentralized. And while you have some very hierarchical systems, even the Catholic Church is pretty decentralized in the reality on the ground. And so it isn't as if you can sort of send out a directive and have answers. So I think that really puts a huge burden on the communication so that people are more aware of what the situation is, the kind of Lancet piece that you've done, because it has not been on people's radar screens, that this is an immediate, large, important dimension of the COVID crisis. Helping to get into the guts of social protection systems so that the good practice that you describe makes its way into the policy circles in country after country, which is where it needs to happen, and where there is a focus on what is good and inspirational as well as what is bad. So unfortunately, I don't think that there is a single answer to it, because it is community by community, but there are ways to put the challenge, but also the opportunities, I think, in more effective ways. Before religious communities, start with Religions for Peace, the Vatican, the Episcopal Church, the OIC, ISESCO. I think that there are many, many levers that we can pull in this crisis to try to move from talk to action.
I would.
Oh, go ahead. We'll move to you, but I just also want to invite the audience to feel free to use the Q&A button below to join the conversation and ask your questions. But Gretchen, please. Thank you.
I just wanted to build on what Catherine was saying, because I think in terms of systemic response and readiness, right? I think the work done around social protection, partly in response to the AIDS crisis, but also just as a tool to build up the poorest of the poor it's just so incredibly important. And I really give kudos to the World Bank, to UNICEF, to the Department for International Development, which is the UK version of foreign assistance. I think, having those mechanisms set up to be able to quickly provide emergency funding to households and continue over time to provide funding to labor constrained households has been incredibly important. I mean, there have been some very good stories about how, and Philip, correct me if I'm wrong, but I think it was Togo that was able to reach millions of people very quickly, actually faster than we did in the States, because they had a good social protection cash transfer system set up and had it already identified. Now, complementary to that, you have to have the social workforce set up, because the social workforce plays a really keen role in assessing families and finding out who needs that help, but also finding out what help above and beyond a cash transfer that children and families need. So I think those things definitely work together in terms of systemic response.
Ani, do you want to give us a picture of some of what you're seeing at the country level? You have this sort of nice purview on country level action. So what are you seeing that's hopeful?
I think the most important and a heartening thing that I would like to say is that what we are seeing on the ground that's working is not different from what has been described in terms of what needs to happen, which is really good. Of course, we are really not able to go to scale. And I think that's also because of a number of references we have heard to, the systemic intervention that is required. And very often we fall back to system strengthening as a response. And then between those two emergencies, we tend to be more focused on issues. And suddenly when a crisis hits, we start talking about, but we need to strengthen the system to be able to respond better. But I think a couple of things that have dramatically improved in terms of the systemic influence, and I think Gretchen and Philip, both of them mentioned, is the work on social service workforce strengthening. And I think that is something that has been pretty ad hoc in the past, where we have been focusing a lot on trainings and capacity building. But I think increasingly we are seeing countries investing more in terms of right from mapping the workforce, what really exists on the ground to be able to strengthen that workforce going forward. So I think a lot of work on social service workforce strengthening has been systemic, and we have seen the results of that also influencing what we are doing in terms of COVID-19, because we have seen a number of countries being able to really understand where the social workers are now, what kind of work they are performing. How do you connect these social workers with mobile technology? Can we establish remote or online case management for these workers? We have seen some really great examples coming out of Bangladesh, from India, from Cambodia, from Rwanda, and so on and so forth, where the government's departments have been able to proactively identify where the workers are and how they can be equipped with tools that are required to respond to the pandemic. So I think the systemic interventions that we are trying to focus on are also starting to bear fruit. So that's something that I wanted to really flag. I think the second important result, and which is not so much relating only directly to children without parental care, but child protection in general, has been the use of technology, and more specifically helplines, because these helplines have really helped not just identifying vulnerable children who may be without parental care, but we have been able to improve issues on reporting on gender-based violence, and then reporting and referrals for GBV. We have been able to start looking at children in street situations more accurately. So I think another big systemic response that has been is to accelerate the implementation of child helplines, which we have seen to a great extent increasing reach of children to the system. So that connection between the child and the system is also improving that way now. Yeah, thanks.
Thank you. And I'm going to again invite anyone who's interested to pose a question in the chat to please feel free to do so in the Q&A box. So
can I put a quick question to
Sure.
Philip? Because
Sure.
what that made me think of is the question of hearing from the children and bringing that perspective into the discussion. You have a lot of knowledge of good practice. Are there any good examples that you've seen of ways of doing that in meaningful ways?
We think it's incredibly important to secure that voice from the very earliest moments of a dialogue on an issue in the country involving the welfare and protection of children, all the way through to the implementation. I think there are good intentions there to do that. There are a lot of examples where, for example, in changing the way we care, we've secured youth voices. We have quite a network of people with lived experience, people who have gone through the experience of living in an orphanage or a children's home, who can share and contribute their perspectives on this. So we're really looking quite intentionally at how we build the capacity of that network within countries and also globally to learn more from those important voices. But I think also, generally speaking, as a sector, there's a lot of discussion on doing this. Well, the UN Day of General Discussion that was referenced earlier in September, I mean, that was almost all youth voices. That was great. But on the ground, we're still a bit far behind. I think it's there's a lot of work we could still do to really make sure that this is just embedded in the practices that we bring to the field, and that these voices are part of the dialogue. It's much better than it was 10 years ago, though, I'd say, and much better understanding with UNICEF in particular, just playing a really important and key role in securing and mobilizing youth participation and voice.
So I'm going to throw out a question. We've talked a lot about the president's emergency plan for AIDS relief and its contributions to this space. There's also a whole of government strategy, right, which I'm very attached to, as you all know. It was launched from the White House in 2012, the US Government Action Plan for Children in Adversity, which was in fact informed by a US government interagency evidence summit on protecting children outside of family care. And the evidence that came out of that summit led to the development of an action plan, which focuses on three core pieces: building strong beginnings for children, really focusing on the early childhood development, and clearly the role of the caregiver is essential in that place. Protecting children outside of family care and putting family care first, and also protecting children from violence, exploitation, abuse, and neglect. And that plan was re-upped during the Trump administration, which was interesting. But Gretchen, I want to know if you can speak to how that plan is also responding, or how the US government agencies beyond your office at PEPFAR is responding to this with those three core objectives in mind. And again, I think the funding piece is so critical. I mean, that action plan is in response to an unfunded legislative mandate. Your office has 10% of all PEPFAR funding to focus on HIV/AIDS, but where are we in terms of funding for this response on the US government side? Can you speak to that at all?
Sure. There's a couple of questions in there. So I think that APCA, or the Action Plan for Children in Adversity, which is now Advancing Protection and Care for Children in Adversity, remains a really important cross-agency coordination mechanism. So one of the things that I think that enabled was early on in the COVID crisis for us to agree on building on the action plan objectives and the advancing care objectives, that it provides a roadmap, if you will, so that I think everybody's sort of speaking the same language about what needs to happen, right? So I think that was incredibly important and remains important, and it definitely forms the basis of the USAID response plan for COVID. And just to say that I am at State Department right now, but my home agency is USAID, as Gillian well knows, since she used to work there, and led the everybody getting together on the action plan. In terms of the US government response, the US has been incredibly generous, as usual, in terms of its foreign assistance around COVID. I think as of October, USAID alone had expended about a little over $9 billion to support countries in terms of primarily, but not only, vaccines. It really has led the world in terms of both direct donations of vaccines and the wherewithal to get those out, but also in contributions to COVAX. So I think that has been really huge. And I think that has been really the biggest part of the USG input, and it's been very important. There has also been funding for mitigation, but I think the driving factor in the US response to date has really been stop adults from dying, right? It's still a huge, to this day, it is a huge hurdle. People are very afraid of taking vaccines, which is very unfortunate. So there's a lot of work that's being done around reducing people's fears and increasing their understanding and knowledge about the benefit of vaccines. So that continues to be huge. The PEPFAR program, as you mentioned, has a 10% earmark and has had that for a long time, from basically the beginning, in terms of orphans and vulnerable children. And I think it's important to know where that came from. It really was the combined efforts of advocacy organizations, child welfare folks, many from faith-based organizations, but not exclusively, who really lobbied Congress to have that in the legislation. And I think if you know, I think the idea of that kind of an effort for COVID is certainly a laudable one. You know, there wasn't 10% wasn't, to be honest, a magical number. It was a good advocacy platform. It has served children well who are affected by HIV and AIDS, and it's not only benefited children living with HIV and AIDS. A lot of the investment has been in building the response locally and at the national level for children in adversity writ large. So I think that having a similar funding stance for COVID certainly has precedence. I don't know of any legislation currently that is looking at that, but I think that certainly it's an idea that has been discussed in advocacy circles as something to look for. I also have to, go back, and I can't remember whether it was Gillian or Catherine who talked about the vast amount of money that goes from, individual citizens and groups, nonprofit and others overseas each year to build orphanages. I think it was something like 3.5 billion. Is that right, Gillian? I mean, how do we redirect those resources into something that is really helpful for children? I think that is something we should be looking at as well as across all of the donors that we have that are responding to COVID, and all of the government bilateral donors. So I think it's a combination of resources that is going to get us there.
And may I jump in a little bit, Gillian? Do we have time?
Yeah, of course.
I think it's important to note that the plan that Gretchen just referred to, the Action Plan for Children in Adversity, it has put the U.S. government, I think, at the leading edge of that agenda globally. It's been a tremendously important program, and protecting children and ensuring that their welfare is promoted is really part of a broader poverty reduction agenda. Children are more likely to be able to attend school and to perform in school and have better health status and fewer social problems. We can go on. The program, I think, has just been at the leading edge. There is an issue, which is that it's very much at the margins of US government funding. So the amounts devoted to that particular agenda are extremely small relative to the need. But that brings up another scale issue when we come back to social protection. There were tremendous efforts last year especially by the World Bank, to finance social protection systems as part of COVID-19 response. And untold numbers of people were reached, and social protection systems are strengthened with registries of families in need, and all this happened very quickly and impressively. But many of those grants were of short duration. So maybe there were 1, 2, or 3 grants provided to families as part of a short-term mitigation, and then the social protection stopped. So if we really think about the fact that roughly 100 million people have fallen into severe poverty, less than $1.90 a day in a very short period of time due to COVID, that's a really big number. Those problems have not gone away, and we have to somehow consider that role of cash social protection being extended beyond those one-off, or sometimes 2, 3, or 4-off grants, to a longer-term social protection mechanism as part of social policy. That's where I think USAID can maybe provide technical assistance and support, but we need to look at other actors. Again, the World Bank primarily as being a potential venue of support to countries that need resources for social protection at that scale.
Thank you, Philip. Catherine, you have your hand raised, and then we have 2 questions in the chat, and we've got 7 minutes left, so we'll try to pack it all in. Go ahead,
Okay,
Catherine.
I'll be very quick. I think we've looked quite a bit at Cambodia for various reasons. And I think there's some interesting lessons there that include the Ministry of Social Affairs, which has really dealt and looked at the question of the orphan population, the orphan landscape. But there's also a very interesting religious group that's focused on some of the evangelical churches, which are mainly American, but also Korean and from other places, that really is trying to redirect the energies and resources, as was suggested, towards much more constructive and productive programs. Chabdai is the name of the organization. So it is this idea that when you have a top-down but also bottom-up, and one that crosses the different sectors, I think that's where we start to see the real potential for action.
Thank you. There's a great question in the chat from Father Gerard McGlone, one of our colleagues at the Berkeley Center. And I love the way he says it. This is actually probably the question we should wrap up with, but it says, what can each of us do with this frightening, amazing data? And if anybody knows how to handle frightening, amazing data, it would be Father McGlone. So I'll pass that to you. This is a question about what we can each do, I think, individually, knowing what we know. Away from big, large systems to individuals.
I'll start. It really depends on where you sit and, and what your capacity is to create change. I think the first thing is just what we alluded to earlier, and that's helping those around us consider as they think about their philanthropy and their support, how they might best direct that. In past emergencies, we're so used to really good people going out and supporting residential care, like orphanages. We've seen it in the tsunami, we've seen it with HIV, we can go on, and we want to avoid that this time. So can we redirect that funding to the kinds of services and supports that we've been talking about today? I think that's good. If you have some sway over a government abroad, or really putting the social welfare agenda at the fore, supporting families, well, let me step back. Let's get those equitable vaccination programs out. We're not going to have a reduction in the number of children who are losing a parent or caregiver until we slow down and hopefully stop at some point the mortality due to COVID-19. So that's really number one. The second is getting all that social welfare on the agenda, the social protection plus the care, and making sure that governments and others in these countries are really promoting family-based care and supports for the children who are affected by this loss. And I can go on with other measures, but I don't want to steal the time from other panelists. Those are just a couple I would highlight.
I'll jump in quickly because we're in a university. I think this issue of knowledge and the building on the kind of information that's available, but it is also combining the data, the hard data with the stories, and finding ways to link the sort of global dimensions that the Lancet article brings home so vividly with what is actually happening at local communities in all their complexity and all of the different categories of children who are made more vulnerable by the crisis.
Ani?
I would continue to emphasize that we must increase our investments in system strengthening, because I think, this is just a classic example of how we scramble to put together systems that can respond, but we really need to redirect our investments to system strengthening. And the second point that I would like to emphasize, and that's something that we at UNICEF are really trying to work towards over this year and next year, is what is it that needs to be done to bring together the child protection system and the social protection system? Because we have cash, we have care, we have cash plus care, but somehow very often it tends to run a parallel race instead of running a joint race. And we need to really bridge that gap between child protection and social protection. And that's something that at UNICEF, we are increasingly deciding should be our priority going forward as far as, addressing the care reform agenda is concerned. Thank you.
Gretchen, did you have something?
I feel like it's been said. Just a lot of great comments, and just just quickly to go back to what Philip said is, even if you're not in a policy position, you have a voice, you can educate people. I mean, I do worry that while it's important to talk about children being orphaned, it's almost secondary to the importance of talking about, but children still have families, and that's where your help needs to go. Build those families, right? Not those orphanages.
Thank you so much. We have 1 minute left, and I guess my answer to that question would be, as a parent and a caregiver, we're tired, right? I mean, look, and I'm among the lucky ones, but we have people in our communities who are wearing out, and recognizing them and lifting up the caregivers. And I would say everybody on this panel is also primary caregiver, right? I mean, you are caring for the caregivers, and thank you for that work. And I think letting our people raising children know that they're doing the most important work in the world, that goes a long way as somebody, you know, in the midst of this much uncertainty and really worrying about your kids' well-being and guiding them through. Taking care of yourself and the other caregivers in your community is where it really begins and ends. Thank you all so much for your time. This is a really inspiring, helpful, grounding conversation, and thank you for your work, and bonne continuation. Thank you.